Hello and good day for everyone. My name is Muhammad Hakimi bin Muhammad Noor, and today I will present my video conference for the title Framework for a Mobile Application with a Chatbot to Self-Report Injuries and Carry Out Contact Tracing for Athletes and Sports Trainers. So this is the table of content including the introduction about the stakeholder, MSD, problem statement, related work or existing application, proposed solution, conclusion and the future work. So the first one is the introduction, the COVID-19. A novel coronavirus, SARS-CoV-2, or known as a COVID-19, emerged in the China late 2019. Currently, COVID-19 continues to spread around the world. Thousands have died after having contracted the virus. So, effect of COVID-19 to our country, Malaysia. Due to the COVID-19, the Malaysian government has closed state borders and seek people to stay at home. Activities such as sport also has been restricted, limited to the home and immediate area. Consequently, sport training activities for athletes and athlete trainers are disrupted. Athlete trainer has found it difficult to assess athlete past or current injuries, and the problem faced by the injured athlete. Injured athletes have difficulty managing their past and the current injuries too, and the problem faced by the athlete and the athlete trainers. Athlete and the athlete trainers find it hard to monitor confirmed cases among their close contact due to limited data on the transmission of the COVID-19 in the athletic arena. And who will benefit by this mobile application? The mobile application will be benefit athlete trainers and injured athletes for monitor injuries. Besides, it can be used as part of the student training and assessment in diagnosing and planning rehabilitation treatment based on the short notes during the pandemic. So next is about the stakeholder. My stakeholder, Ms. Nur Fatihah, is lecturer from University Technology Mara, Shah Alam, from Faculty of Sports Science and Recreation. She teaches athletic training and sport injury subject, course code SPS 290, Fundamental of Exercise Rehabilitation, and SPS 523, Sport Injury Care and Safety. She teaches emergency treatment services and assists her students in designing the training programs. So her students need to do inspection face-to-face with the athlete using the SWOT notes method. SWOT notes method is an acronym for Subjective, Objective, Assessment and the Plan. The focus is on the musculoskeletal disorder, MSD. So MSD, musculoskeletal disorder, is a degenerative disease and inflammatory conditions that cause pain and impair normal activities. MSD involves soft tissues. It affects many different parts of the body, including the upper limb, lower limb, upper and the lower back. To diagnose this injury, medical staff or athlete trainers need to do assessment based on evaluation or self-report using the SWOT notes. So, process of SWOT notes. Currently, they have 4 processes: subjective, objective, assessment, and plan. For the subjective part, gather information on the injury histories and symptoms. Injury histories including athlete impression, athlete's own word, where and how do they feel, site of injury, provoked tissue, normal tissue, pathological tissue, mechanism of the injury, macro trauma or micro trauma, the duration of the force, sound or sensation, and lastly the previous injury. So the other information needed is behavior of the symptom. Behavior of the symptom including provocation of the symptom. Athlete will be asked to recreate the symptom by performing some movement. Quality of the symptom, sharp, tingling or burning. Region of the symptom, either localized or spread. Severity of the symptom. The athlete will give the pain scale 0 to the 10. Timing of the symptom, either macro trauma or micro trauma. Next is the objective. Identify athlete injuries by doing observation and inspection. So it includes the postural alignment, normal and not abnormal posture, and sign of the trauma. Postural alignment should be done in weight-bearing, standing position, and view from different angles: anterior, posterior, medial, and lateral. Next, observe signs of trauma such as cross deformity, swelling, bleeding, sign of infection, and atrophy. And the third phase is the assessment. Document their findings. Students do a judgment, impression of the nature of the injury. The conclusion is drawn based on the previous and current subjective and objective evaluation. And lastly, plan. Short-term and long-term treatment plan. Next is the contact tracing. It aims to reduce the transmission of the COVID-19. It also used to find and assess closest contact of the infected. Mainly used in the sport that involve physical contact such as soccer and rugby. And if the athlete is infected, should immediately seek treatment and they need to be quarantined. Next is the problem statement. Currently they have three major problems. So the problem 1 is student having difficulty to find injured athlete or person. 28 out of 70 students state they have three problems. Finding injured athletes and person is difficult because they cannot find anyone during this pandemic. Besides, there are no specific platform or application to help them find injured athletes or person. The second problem is student having difficulty diagnosing injured athlete or person face to face. 58 out of 70 students state they're having difficulty to this problem. Previously, students can diagnose injured athlete or person face to face at the UiTM facility. However, during online distance learning, they cannot perform those tasks for their assessment. The third problem is students having difficulty with the online platform. 26 out of 70 students said they have this problem. To have an online meeting, both sides need to schedule a free time to meet. Besides, observing injury site on a live video chat is not suitable for diagnosing purpose. For example, if the person has leg injury, they need to raise their leg in front of the laptop or computer. It is depressing to do and impossible that athlete trainer give the inaccurate treatment, diagnosis and plan to the injured athletes. Hence, it will be difficult for the student to finish their assessment. Next is a related work and existing application. For the related work, empathic chatbot response for the medical assistant. So it consists of advice-only chatbot and empathic chatbot. For the existing application is such as ELISA. ELISA is first chatbot was created in 1966 by Joseph Rosenbaum, who is a German computer scientist. ELISA is capable of receiving statements from users, rephrasing them, and sending them back as a question. Next is the Sermo. Sermo is a private social media network for physicians that support people with mental illness using the cognitive behavior therapy, CBT. The psychologist also approved Sermo as a verified mental illness mobile application with a chatbot that helps the patients. Next is the Flores. Flores is a healthcare chatbot that uses a smart algorithm to assist and monitor patients' health and the condition. Flores gather information such as weight, mood, and other related information. Then it will give advice based on the symptom of the illness using the social media. Next is the Propose solution. Propose a mobile application with chatbot for injured athletes to self-report their injury as well as perform contact tracing. The platform will be used by athlete trainer to plan treatment for the injured athletes. Next, the project will use a modified waterfall model that use 4 out of the 7 phases. The 4 phases is the requirement gathering and analysis, design, implementation, and the testing. Framework of rule-based chatbot. User first put the input. The chatbot search input for the keyword, match input to the intent-based keyword, pick response based on the match intent, and lastly, display the response output. So this is the first one on the modified waterfall methodology, which is requirement gathering and analysis. This study obtained information using the online interviews and surveys, document in the requirement diagram in the SRS, and stakeholder review all the requirement that she had request in a form known as a requirement validation form. So this is the activity diagram. If the user have an account, they can log in, but if they doesn't have an account, they need to create a user account. After login, if the user type is athlete, they will redirect to the athlete homepage, check with the Attibot, and provide injury info, then log out. If the user type is student, they will redirect to the student homepage, And they can view the assessment report, assign them to the assessment, and they can retrieve all the data and athlete injury for the assessment, then log out. The second phase is the design. During this phase, we define the rule. Developer will discuss and review what respond with the expert, who is the stakeholder, to ensure the information is accurate and not misleading. Next, we document the design of the mobile application in the system design document. And lastly, design the storyboard of the application. So this is the task diagram of 6 tables, including user account, lecturer, student, athlete, chat, and the assessment. One lecturer can have one user account, one lecturer can create one or many student account, one student can have one student account, one athlete can register one user account, one athlete can perform one or many chat, and one chat will generate one assessment form. One student can view one assessment at one time. The next phase is the implementation. We develop the project for both Android and iOS platform. Developer will ask stakeholder to review the mobile application, and comment and feedback from the stakeholder will be used to improve the prototype. So the example of the user interface. User, who is athlete, will chat with the Chatbot and provide the details. Chatbot will respond and gather required information from the athletes and ask for the image, and user will upload the injury image to the Chatbot. And the last phase is the testing. Developer and the stakeholder will test the application to ensure it meets the overall requirement. Developer will prepare a test plan that consists of few possible scenarios. Comment from the stakeholder will be taken into account, and errors made during the previous testing will be fixed. The testing phase will recur until the stakeholder is satisfied with the end product. And this is the last section, conclusion and the future work. In the conclusion, we believe that this mobile application will be benefit athlete trainer and the injured athlete. Injured athlete will be able to receive a treatment plan and seek tips and help for their pain or injury to recover faster. And this mobile application will also carry out contact tracing during the pandemic. And the future work. The main goal is to develop a mobile application with a chatbot for athletes and trainers to self-report injuries and carry out contact tracing during the pandemic using the proposed framework. So that's all from me. Thank you for watching my video conference, and have a good day for everyone.